Hello, my name is Charles Penza, and I'll be presenting on market efficiency and how it relates to the pharmaceutical industry. This is my presentation for Economics 101. So first off, to start the presentation off, what is market efficiency? Market efficiency is when the market allocates all of its resources efficiently. Market efficiency refers to a market where the price of the product being sold can resemble all of its relevant financial information. So there's no hidden cost or anything like that. When a market is efficient, it gives the buyers and sellers an equal opportunity to execute trades. In an efficient market, prices of goods and services can quickly adapt to new relevant information. So for example, if the demand for a good or service changes, the price may change. Moving on to the key aspects of market efficiency. The first is information reflection. When a certain market is efficient, it will directly reflect the information given for the product, as we mentioned. Implications for investors. In a perfectly efficient market, it cannot beat the market without taking on additional risks to the product. This makes efficient markets more likely to be bought by investors. Next, I'm going to talk about the efficiency related to the pharmaceutical market. The pharmaceutical market serves its efficiency through its adaptation to world news. It's extremely transparent through all the stages of developing a drug. They are required to give extensive public disclosures with trials, drug approvals, and necessary safety updates throughout the development process of a new drug. So since the market is so transparent, it's able to maintain its efficiency through the public. Big pharma industries were able to quickly adapt to the COVID-19 protocols as quickly as possible, which makes this market so efficient. The inefficiencies of the pharmaceutical market. The pharmaceutical market can express inefficiencies in many different areas. The market is solely dominated by a conglomerate of monopolistic pharmaceutical industries. With this, they can use patents to charge whichever desired price to patients. This is counterproductive to maintaining efficiency and transparency to patients. So with these big patents that they get for these new drugs, it doesn't allow smaller pharmaceutical industries to be able to use the same drug. So it eliminates the competition and allows these industries to charge whichever prices they want for the drugs that they create, which causes inefficiency in the pharmaceutical industry. Continuing with the inefficiencies of the pharmaceutical market. An article from the Time magazine states, a perfect poster child for undeserving patents is Regeneron's product Eylea, which treats an eye condition known as macular degeneration that affects older adults. Eylea was approved by the U.S. Food and Drug Administration in 2011, and thanks to over 90 granted patents, the drug is unlikely to see any generic competitors for years to come. So in other words, big pharmaceutical patents play a big role in inflating the prices of new drugs. Time magazine also mentions how the price of the same drug is half of the price in the UK. Drug patenting schemes have a direct impact to the efficiency of the market as a whole. Patents allow the monopolies to grow bigger and allow little room for smaller research and development companies to develop new drugs. Without patents or patent schemes, drugs would likely become less expensive and allowing for an efficient pharmaceutical market. So these big patent schemes are a direct impact to why this industry can become so inefficient, where these monopolistic industries develop new drugs and put patents over them, so no smaller research and development industries can follow up with that development. As the demand for these drugs with patents are relatively inelastic, pharmaceutical industries are able to take advantage of how they're able to charge for new drugs. Whether the prices of new drugs are high or low, inelastic demand allows for higher price points when using drug patents. An article from Real Solutions states, while patents play an important role in incentivizing pharmaceutical innovation, they also can be used strategically to impede competition by delaying generic drugs' entry into the market. So these patents allow the monopolies to keep their drug inventions and, as we mentioned earlier, don't allow the smaller research and development industries to develop the same drug. To further explain, government-protected monopolies strategically use patents to maintain profitability but leaves the market becoming inefficient. Government-protected monopolies overall drives efficiency down. Moving forward to patent extension. Manufacturing industries also use a tactic to extend patent time to minimize any outside competition. The article from Real Solutions mentions how it's ironic that with the Hatchman-Waxman Act in place to expedite the entry of biosimilars, large brand name manufacturers developed tactics to extend the patent well beyond its original time frame. This allows for the pharmaceutical companies to maintain its market exclusivity and prevent outside competition for a longer period of time. Moving on to evergreening. Evergreening is one of the smaller components that goes into repatenting a new drug. Evergreening is the overall extension of market exclusivity beyond its original patent term through very small modifications to the original drug that was patented. Companies usually modify delivery systems, composition, or a small change in dosages. This allows companies to repatent the product as it's technically a new drug. Evergreening is one of the main components that leads to economic inefficiency in the pharmaceutical market. Another component of extending a patent is patent thickets. Patent thickets are a form of extending a patent but staves off competition in a different way. Building a patent thicket involves filing multiple different patents on the same drug but on an individual component of the drug. This makes it extremely difficult for outside competition to enter the market of the patented drug. Since there is a thick layer of patents, this will maintain the exclusivity of the monopolies of the pharmaceutical market. The last component of maintaining market exclusivity is product hopping. Product hopping involves moving a company's existing patients to a reformulated version of the drug they were prescribed. Right before the patient's drug is about to expire, they prescribe you to the reformulated drug. This prevents any substitution drugs to be used for the patients. This being said, it also maintains the company's exclusivity. For example, the article from Real Solutions states, originally AstraZeneca marketed Prilosec, which became a popular drug for treating GERD. However, as the patent expiration for Prilosec approached in 2001, the company developed a patented a new version of the drug with a slightly different enantiomer profile. Counteracting the inefficiency of the pharmaceutical market. To be able to counteract the effect of patents in pharmacy, it would have to allow Medicare to negotiate high drug costs. This would help drive the cost down and work towards market efficiency. Time magazine mentions that the way forward involves 3 types of reforms in the U.S. patent system. Congress must work with the United States Patent and Trademark Office and FDA to raise the standards to what deserves a patent or not. Having all major drugs being patented creates an inefficient market for both buyers and sellers. The second method of counteracting the inefficiency. The article from Time magazine states that there needs to be a stronger balance between public and private interests when it comes to ensure more transparency and accountability. The main factor of market efficiency comes from transparency and price directly reflecting relative market information, as we stated previous in this presentation. This could be accomplished by the USPTO, Time magazine states. Having patents being more publicly transparent would overall help the pharmaceutical market efficiency. Overall, the process of acquiring a patent for a new drug needs to be challenged or revamped. The pharmaceutical industry has multiple ways of keeping market exclusivity directly impacting the market's efficiency. Pharmacies should not be able to have free range to place a price point on undeserved patents. Congress must stand up to the drug makers' anti-competitive tactics to maintain profitability and market exclusivity. In conclusion, competition in the pharma industry is shaped by the monopolistic exclusivity from patents. This plays a huge part in its effect in market efficiency. Market efficiency is a large part of the pharmaceutical industry and can easily be swayed by big pharma companies. Market Efficiency and inefficiency are both demonstrating, showing how the pharmaceutical market can be seen.